everyone, and welcome to a special episode of Coffee Talk Live. I am Coach Connie Pastorius, online health and fitness specialist and showrunner here at Strong as a Mother. Today, I have the pleasure of introducing you to somebody that I have been looking to connect with for a long time, a pelvic floor physical therapist, and she is so excited to share what she has to tell you guys today. Question and answer style. You're going to learn so much. And here is Dr. Helene Darmanin. Hi, Helene. Welcome to the show.
Hi, thank you so much for having me.
I am so happy that you're here. So you are the owner, creator, woman in charge of Mamabear PT, and it is a real personalized care with a soul that gives you the support you need to move through parenthood. So Mamabear PT offers tools to alleviate pregnancy, aches and pains, prepare for birth, successfully breastfeed, and find your new normal postpartum, all in the comfort of your home with their convenient virtual sessions and classes. Helene, I am so excited to have you today. And I read that right off of your website because it was just spelled out perfectly. And I really want to let you take the reins and just let's start with a little bit about you. I want to hear what got you into the pelvic floor part of the physical therapy world and what kind of drove you to starting this online practice.
Thanks. Yeah. So I've been a feminist my whole life. I was raised by a really kick-ass single mom who is just absolutely badass. She was a public school teacher and raised me and my sister in Brooklyn by herself. And so I've always felt myself drawn to working with women. And I was also a dancer and studied exercise science in undergrad, and I wasn't sure how to marry the two. I worked as a personal trainer for a while. And then I went back to grad school for physical therapy. While I was in grad school, I discovered that pelvic floor physical therapy was a thing, and it blew my mind because I've always been fascinated by birth and children, not the children themselves so much as the process of actually having a child and then the moms afterwards. So it was the perfect marriage of everything I've loved, healing people with exercise and birth and feminism, because this is an area that's so underaddressed. And I specialized in pelvic floor therapy, but also orthopedic therapy based on my previous history as a personal trainer. And the two of those together are really what it takes to work with pregnant and postpartum population, because you want to be able to address any pelvic dysfunctions, but also back pain is, I think about 100% of women experience back pain during pregnancy. And also things like diastasis recti are kind of the marriage of that orthopedic and pelvic floor treatments. So that's how I came into it. And then I felt even more strongly about it after I was already practicing when I had my little one, who's now 16 months. And I, even knowing everything I knew, nothing can really prepare you for the experience of being pregnant and giving birth, and being postpartum. And I needed physical therapy after I gave birth. And I needed to ask my OB to give me a prescription, even though she knew I was a pelvic floor physical therapist. And then I couldn't figure out how to get to PT. I had a little guy, he was nursing. I didn't want to leave him. I didn't know how to get on the subway to go to a physical therapy clinic while my vagina felt like it was on fire and I couldn't sit down. So eventually I figured it out. My in-laws came and watched my son, and I was able to get to a clinic for a few visits, and then complement it with my own knowledge and caring for myself. But I realized that that's a huge gap for many people. And COVID kind of gave me the answer I needed, because I started practicing virtually out of necessity and found that I was able to help women prepare for birth, ease their pregnancy aches and pains, and then recover from birth, all with virtual sessions. And that led me to found Mamabear. And then I also had my incredible team who helped me after I gave birth, my lactation counselor and my doula, who I've been in touch with and have been a constant support and great network to bounce ideas off of professionally also. And they're joining me so that we can offer all these different services. So it's such a privilege to lead a team when I know how incredibly effective they are, because they were my care team.
That's so, so incredibly awesome that all of this, what you created, was born of a necessity, like you said, in COVID, because your story, you are a pelvic floor PT and you still had the same struggles that so many women have with needing access to that very specialized care, and not being able to, and not even knowing, for a lot of people, not even knowing where to start.
Yes.
And for me, I didn't realize, I didn't even realize when I was a personal trainer that pelvic floor PT was a specialty. And then I had my baby, she's 2.5-ish now. But after I gave birth, my journey with pelvic floor health started at that 6-week checkup afterwards. And it was awful. I mean, I had a great delivery, I had a great process leading up to then, but that 6-week checkup was so impersonal. It wasn't my actual practicing OB, and they didn't check me for diastasis until I asked them to. They just did a visual exam of my vagina, of all these parts, and they're just like, all right, you're fine. And at such an emotionally delicate phase in the postpartum period, just to hear that after I felt so uncertain, things didn't feel right, things didn't feel like in the right place. I was still having pulling feelings in one side of it, in one side of my vagina, and I didn't have any support there. So I had to go, and I found an out of network. I feel like they're all pretty much out of network, in Manhattan. And when I went there, I paid the premium price, but when I had a really great experience, she did an internal exam, kind of gave me that confidence and that support that I needed to know, like, how bad is what I'm feeling? Is this normal? And, I took that and I, progressed through my healing process. But the act of having to find somebody, had to find out that they're not in the insurance that I pay, at the wazoo for. This is a conversation that's very normal for so many moms. And then for me as a fitness coach, I'm sure you know as well, women will come to us and will ask, like, okay, how was your birthing experience? Is there pain? Is there discomfort? Do you have any leaking whenever you do like jumping jacks or anything? And they say, like, oh yeah, like there's leaking. I can't really do burpees, or I can't bounce up and down. I wear pads all the time. And they say it like it's normal and like they accepted this is their reality, but it's not. Yes. And this is where pelvic floor physical therapy comes in, because my scope of practice stops at a certain point and where I know that I need to refer out. And this is where I think we can start having the conversation about what is the pelvic floor? What are common things that you've had conversations with clients about? And what are things that are, they're common, but not normal and manageable, that some things that you can fix and can improve on. So before I release you and have you tell us all this wonderful information, I want to let everybody who's watching know that you're welcome to post questions that you have in the comment section, and we will get to them closer towards the end of the conversation. But please feel free as they come along, or feel free to share your experience if it's similar to mine, or similar to Helene's. If you have been, struggling with any part of your journey through motherhood. All right. Yeah. So Helene, starting with the basics, what is this pelvic floor we keep talking about, and why is it so important?
Yes. And I love that you said common, not normal. That's the pelvic floor PT tagline. We say that about everything, because there's nothing shameful or taboo. There shouldn't be this stigma about it. But it drives me nuts when I see greeting cards and t-shirts that joke about leaking with double unders, because you don't have to. It's a medical condition, the same way that you wouldn't be ashamed if you had juvenile diabetes. You should not be ashamed if you have urinary incontinence. But you asked what the pelvic floor was. So I have my trusty model here with me.
Yes.
Here's a pelvis. So
Hi,
just
pelvis.
to orient you, I have to name this pelvis. It doesn't have a name yet. One of my mentors has a pelvis named Penelope, which is a great name for a pelvis, but I don't think I can steal it. So here's the front of your pelvis. This is your pubic symphysis, where the two halves of your pelvis meet. If we had the leg bones here, they would fit into these sockets on either side, just to orient you. And then here's the back of your pelvis, bottom of the spine into the sacrum and the tailbone down here. Mm-hmm. If we look as if you were laying down, so now you're looking up towards the vaginal opening, you can see this is the most superficial layer of pelvic floor muscles, meaning the closest to the skin here. So you can see, here's your vulva, clitoris at the top, and then inside the vulva, here's your vaginal opening. Mm-hmm. And then here's the anus back here. In between the vaginal opening and the anus is the perineum. And you can see a lot of the pelvic floor muscles meet here at the perineum. And
so everything that's red right there are muscles?
Muscles, yep. Okay. And this is where you usually have some tearing, or if you had an episiotomy, that's where it's going to happen during birth. Now, this outermost layer is mostly sphincters. So those kind of circular muscles that squeeze, they're kind of our last line of defense for maintaining continence, holding in urine, feces, gas. You can see there's a ring of muscle here too. And then if I flip this way, so you can see there's deeper layers here, which you can see better if I flip this way. So now you're looking head down into the pelvis. And these are deeper layers of pelvic floor muscles. There's a number of them there. And these are more responsible for holding your pelvic organs in place. So I actually have pelvic organs here that I can put in place. Your rectum, which it goes in the back here, obviously. And then you have your bladder, which has the urethra, which comes out of the urethral opening, which is between the clitoris and the vulva. And this is the actual walls of the vagina up into the cervix, into the uterus, which kind of comes in here between the rectum and the bladder. So those muscles, the deeper muscles, are responsible for holding these pieces in place so that they don't look like this pelvis currently looks, so that everything's all in nice alignment. So that also helps with maintaining continence, since that's something we've been talking about. Because if those organs are held nicely in place and have nice support, then the pelvic floor kind of acts like a trampoline and can absorb the forces. If those muscles have had, big stress or have some weakness, then your organs are going to be kind of sloshing around. That will make it difficult for you to hold urine in, especially. So that's the multiple layers of your pelvic floor muscles. Something else pelvic floor muscles do is they're involved in orgasm. So if your pelvic floor muscles are nice and healthy and can move nicely up and down, you're going to orgasm more readily. Orgasm is associated with multiple rhythmic contractions of the pelvic floor. So that's another reason it's really nice to have a healthy pelvic floor. And it also helps with breathing. It moves in concert. So the pelvic floor and the diaphragm are parallel to each other. And as you take an inhale and the diaphragm goes down, the pelvic floor also goes down, so that the contents of your abdomen don't get squished every time you take a deep breath. And then as you exhale, the diaphragm relaxes and the pelvic floor comes up also. So they kind of mirror each other. Okay. And you can even try right now, if you take a big inhale, you might feel your perineum move downward. And as you take a big exhale, you might feel your pelvic floor moving up. It's a little weird, and sometimes people feel the converse or the opposite when they first start trying, but that's how they work together. And that's the easiest way to get your pelvic floor moving again post-birth, is to start taking nice, big, deep breaths and getting the pelvic floor moving through a full range of motion. Even better than Kegels.
So Kegels, I was gonna mention that when you were pointing out all the muscles. So whenever someone says like do a Kegel, you're like okay, squeeze. So like if you like either used your little Elvis the pelvis, whatever you want to name it, and show us what muscles are contracting or supposed to be contracting whenever we're encouraged to do Kegels, which I understand, and you tell me if I'm wrong, is actually an overprescribed solution.
Thank you. Yes. So actually much more important to have the pelvic floor be able to relax fully than it is to have it contract fully, because again, you want to have that nice full range of motion so that it can act like a trampoline, rather than if it's very tense and rigid, then it's not going to be able to react to those forces. So deep breathing, and especially in New York City, when I was seeing clients in person, more often than not, I would hear things that made me and feel more muscle tension and more of a tight pelvic floor than a weak pelvic floor. So maybe
Mhm.
that's a New York thing. I don't know, but definitely I would rather have someone doing deep breaths for their pelvic floor than Kegels. But Kegels are also lovely. When you do a Kegel, all of these muscles contract in concert. So they're going to pull these are your sit bones down here where your hamstrings attach, and what you're sitting on right now. Those two muscles are going to pull in towards each other. And then at the same time, the front to back muscles are also contracting. So your pubic bone and your tailbone are going to move closer together. This whole diamond is going to get narrower when you do a Kegel. And then also the perineum should go up in towards your ribs. So up into the body. I've heard so many different cues for a Kegel, like try to pick up a blueberry with your vagina. There's lots of really great ones out there, or feel like your perineum is an elevator going up your spine. But that's basically what's happening. And then and you can even feel, again, if you do that deep breath, as you relax your pelvic floor, so as you inhale and your pelvic floor descends, these 4 points are going to get further away from each other, which is what we need when we're defecating, giving birth, anytime we're holding tension, basically. But that inhale is actually going to bring those 4 points away from each other.
Okay, so these are different muscles than contracting your anus, correct? Like that's a different sensation, or is this whole part of the game?
The anus is included in the pelvic floor. That's a great question. So all these big muscle fibers back here are also part of the pelvic floor. So the
Okay.
whole thing is going to feel like it's going in. Now,
Okay.
do you want to, sometimes if you think of contracting the anus, you're just going to get that anal sphincter. So we don't want to do that. We want to think more, if you're consciously thinking of the muscles, I like to think of the perineum, that little spot there that actually feels a little like knobby if you touch your own perineum, because there are those muscles joining there. So I like to think of taking that little knobby bit up and in.
Got it.
Yeah.
Perfect. So this sounds, the overprescription of Kegels is a very important thing to address, because I think that's like the first line of defense when like a doctor who doesn't necessarily have a lot of expertise hears from a patient like, oh, I think I have, this problem A, B, and C, and they're like, okay, do some Kegels. Because I think every mom in this who's watching this has been told at one point or other by a health professional to do more Kegels. But as you stated, and as I've noticed in my own personal training, experience with my clients, I've had them ask questions like, is it better to contract your abdomen all day long to like help build your muscles there? And I say no, for the same exact reason. Because whenever we hold tension, we create tension, we have that inability to relax. And for a lot of us, when we are emotionally stressed, parts of our bodies tense up, and then we have a hard time relaxing. So for some of us, like it's our shoulders, so have a hard time, getting it down and back. But for some of us, we hold that tension in our pelvic floor region. So if someone is holding that tension there and holding that stress, and then they're being told to do Kegels, they're almost doing more damage than they are helping. And this just kind of invites the conversation in more of deep breathing practices, meditation practices, yoga practices, and inviting the relax phase in. Because I don't know about you guys, but if my husband tells me to relax, that's almost like a trigger word to be like, no, you relax, I'm fine. But the fact is that we really do need to understand what it feels like to fully relax in our bodies.
Yes. And I think you hit upon a great point, which is that, adding tension is not the same as building strength. So strength, a really strong muscle, I liken it to, a bicep curl. from here, if I can't go anywhere else, how strong is my bicep? Now, if I can pick something up from the floor from a straight elbow and bend it all the way up to my shoulder, now there's a strong bicep, right? So we want the same thing for our pelvic floor. We want it to be able to relax fully and then contract fully. Because even if you are doing Kegels on top of a tight pelvic floor, you're not going to be getting a very good contraction because you're not getting that full relax, contract. And that juicy movement feels nice, but it also builds muscle the best.
Right.
So that's why I like working on relaxation first. Yes. And
that's an excellent first stop.
Yeah. Yeah. And deep breathing is a beautiful way to do it because it helps with so many things because it actually has an effect on the nervous system in addition to getting the muscles moving and having that mechanical effect.
Yes. So, okay. I'm checking in with our group first to see if any questions have popped up so far, but so far Erica chimed in. So for anyone who's watching, in the Strong as a Mother group, I have my resident nutritionist, who's also a coach in my coaching program, a nutrition coach, Erica Scholes, who is the reason I met Helene in the first place because she's your doula and she works in Mamabear physical therapy as well. So Erica suggested Penelope or Portia.
Portia.
I like Portia. I like the exotic car sound of it for pelvic floors. But we'll continue with the conversation and see if other questions pop up in the meantime. Thanks, Erica. I'm so glad that you're chiming in and saying hi. So what would the next what's the next thing you want to discuss or bring up? What's something else that's really common in your world?
Yeah, well, I wanted to also say, based on what we were just talking about, that some ways to tell, like, you might be listening to all this and thinking, how do I tell? Do I need to relax? Do I need to Kegel? What do I need to do? So some common things that I hear from people who have pelvic floors who are a little more tense, and this is women and men, though we hear about it more in women because women have shorter urethras that are straight downwards, which is why we leak urine a lot more easily. And also we give birth. But men have very long urethras that have to travel from their bladder up through their penis. And the whole thing is not against gravity because it kind of takes that circuitous path. So it's a lot harder for men to leak urine, though some men do. But if I hear someone tell me that they have pain during intercourse, especially pain that is from the onset of intercourse, usually if there's pain from friction, then you'll feel it get worse as you go, and using a nice, healthy, safe lubricant can help with that. But if it's pain that is from right initial penetration, then that's often associated with a tight pelvic floor. If you have difficulty fully emptying your bladder, you go to urinate and you feel like when you get up, you still feel like you have some urine left and you need to go again. That can also be the sign of a tight pelvic floor. Also, if you have difficulty taking a deep breath, and usually if you have a tight pelvic floor, you tend to have your tailbone kind of tucked under you a little bit more. That's a posture that's associated with tight pelvic floor. Those are things that I hear when someone's telling me, or even constipation, because if the pelvic floor muscles can't relax, it's very difficult to defecate. So sometimes constipation, if you've done all hydrated and eaten your fiber and all that kind of stuff and you're still constipated, that could be a missing piece of the puzzle. So that's usually what I hear for tight pelvic floors. On the flip side, if it's more of a weakness, then I'm hearing things like leaking urine. That's the biggest one, really. Pelvic pain also is often associated with a tighter pelvic floor. So if you do have any chronic pains in your pelvis, or like you mentioned, Connie, after you gave birth, that you had like kind of that pulling sensation on one side, which is very common after giving birth, then that can also that's also associated with tightness in the muscles, because they can become asymmetrical. They do have sides to them, so you can have more tension in one side based on how you gave birth, or if you have tearing when you gave birth.
Yes, it was the side where they did stitches.
Mm-hmm.
And so I delivered, it wasn't my OBGYN delivering, it was whoever was on call, which again, I don't care, whatever, do your job, get the baby out, that's fine. But she had a resident coming in to do the stitching. So she was like, I have a resident here. She's going to practice stitching if that's okay with you. And like, I'm delirious. I didn't really care.
That's not a time to ask for consent. That's crazy.
Well, whatever. But I mean, I was like, okay, it's stitching. Like, how hard can it be? But if it took, like, she never told me like, how many stitches, how deep it is, like what was the level of tearing, but she took so long. And in my delirium, I was like, how much longer is it going to take down there? And they're just like, I don't know, some comment. And then at one point I was like, make sure you spell my name right. Because she was just hanging out and doing the stitches so long that it was just my like impulse response is comedy. Because I'm just like, dear Lord, like, when are you gonna stop? But it was actually an awesome experience for me when I gave birth. They had a group of maybe 8 to 10 first year med students in. And they also asked me permission, like, can we witness your push, whenever, because it was time. And I'm like, yeah, bring everyone in. I don't care. Because my mom, I don't think my parents were there yet at that point, but my husband was there. But either way, I didn't really care. I was like, come on in. So I had this whole cheering squad, all women, just like cheering me on and just watching like a theater and there to like help, encourage me and all this stuff. And like, after like a horrible night, that was like the best thing I could have had, was that team of first year students cheering me on. And it was so special and awesome. And I don't think I'm ever going to get that again. And they came back later and asked like, how you doing? Like, what'd you end up naming her? And all that stuff. And it was really supportive and sweet. But yeah, that was a fun day. I think I got a little off subject, but yeah, we all have our stories, and what's awesome about it is that the more conversations that I think we're having around our true experiences, especially the postpartum period, the better care that we can start finding
Yes.
for ourselves and for each other. So you made some excellent points about what could be a sign of a pelvic floor being too tight, signs of it being a little weaker than optimal. So what role does your business play if someone goes from, okay, I think something's not right, to, okay, I want to get help?
Mm-hmm.
What role does your physical therapy business play, and how is virtual different than what they would normally get in person?
Yeah, it's a really great question. I have had a lot of people be like, how do you do pelvic floor physical therapy virtually? And that's honestly what I would have said, a year ago, like 13 months ago. But I treat it very similarly to a knee injury, honestly. So what I do is I use an impairment-based treatment, which means I look at what's not moving well, and then we make it move better. So in some cases that might be these muscles that are kind of that would be around here are the glutes. So if the glutes aren't doing their thing, then the pelvic floor is not getting support, and then it might be tensing up because it doesn't have support. So then we strengthen the glutes, and we get things moving well together. Also, doing some more very guided work on breathing, on visualizing and relaxing the pelvic floor. I have coached folks at home to use tools like this is a pelvic floor wand, where I will coach people, and usually they take my instructions and go somewhere private and do this themselves after our session, and use the lubricant to gently do some sweeping motions to help relax the pelvic floor. Or you can find a trigger point, and again, I coach people through this, and hold some pressure on that. Or if we find that someone does need to do some Kegels or something, this is a really nice low tech, this is called the means educator. So you can insert this vaginally, and then if you're contracting well, just by the direction of pull of your muscles, you'll see this little flag come up. And if you're doing the reverse, which oftentimes people think they're contracting, but they're actually bearing down, which is the opposite of a contraction, then you'll see this go down. I love this. This is a British thing. Of course, the English came up with this. It's like $20.
That's amazing.
And it's so, because you see all these Kegel trainers, and I do sometimes find that people need something a little bit with a little bit more feedback than that. But this one is fantastic. It comes with a booklet on how to use it, the Neen Educator, Neen, so that if you do want to do a home program, you can figure out how to do that. And then some of it too is, the big thing is patient education. So some of it is as simple as, oh, I'm urinating all the time. Hey, what are you drinking before you go to bed? Oh, I drink iced tea 30 minutes before I go to bed. Well, tea is a bladder irritant, unfortunately. So part of the reason that you need to get up 3 times to pee in the night might be just because there's tea sitting in your bladder, irritating the bladder lining and giving you the sensation that you need to urinate. So there's a lot of pieces to the puzzle. And that's honestly why I love what I do, because I love helping people put that puzzle together to then never have to worry about this again and have their own tools in their own toolbox, and not need me, except that I really like getting emails a few months later with baby pictures. So I do love that. So that's how virtual PT works. The nice thing is that in New York, you don't need a prescription to come to physical therapy for the first 10 visits or 30 days, whichever comes first. And unfortunately, as you mentioned, most pelvic floor physical therapy is out of network because insurance companies are an absolute nightmare. I had an insurance company try to pay me $30 for an hour of my time. I have a doctorate and over a decade of experience in movement, so that was pretty insulting.
Yeah.
But we help folks get reimbursed by insurance and figure out how to check for benefits. So you can contact us directly and we'll help you figure out benefits. We'll help you figure out how to get started and what resources might be helpful. And I'm also, again, knowing that it's hard to afford and hard to access a lot of times, I'm working on putting out a lot of free resources, including our launch, which is coming up this Thursday, which is an hour and a half of free webinars and a free postpartum prenatal workout. And lots of swag being given away, including like this shirt that I'm wearing right now.
It's such an awesome logo. It's excellent. I love it.
I love it too. I had a kick-ass woman design it. And
women are the best.
I know.
Continue.
So, and that will have Erica, as you mentioned, will be giving a little chat on nutrition for pregnancy and postpartum. I'll be giving a talk on some pregnancy and postpartum self-care and teaching the fitness class. And we'll also have Disa, our lactation specialist, give a little talk on breastfeeding. So all that is happening Thursday. It's free, just mamabearpt.com.
And we'll drop that link in the comment section because everybody should go to this kickoff event. The way that you're describing this online resource, I kind of noticed too, like I've been an online trainer for over 3 years. So the universe let me prepare for COVID, because the second it hit and lockdown happened, I just put my hand up and I was like, I know how to help, which is awesome. And I think more and more things we're recognizing don't have to be in person. And even though like when I had my pelvic floor assessment, it was internal, it was still optional. Like I could have gone and said no to the internal exam. But what virtual is allowing women to do is to learn their own anatomy themselves and have a far more empowered experience, because you have to, first of all. But now we're starting to take our health into our own hands. And the school system let us down, college let us down. I did not learn any of those muscles that you pointed out to us, even in my undergrad for exercise science. They skimmed right over. And that's kind of the reason why I leaned into, working with women and moms, because there's so much that we weren't taught, that taking this stuff and utilizing the online experience, it prevents us from having to schlep onto the subway or to drive out to Long Island or cross state lines to get the best care. We can get top level experiences that are covered by insurance, or at least more affordable than some other options, by having these online resources. So I'm so excited that you're launching this, and I'm so glad to hear that you are just out there and your goal is to support women and help them and educate them, because I absolutely love the idea of helping cultivate this sustainable relationship with nutrition and exercise and movement in our bodies. And we do that by educating and teaching and empowering women to understand what works best for themselves and how to live this sustainably healthy life. So that is my grandstand spiel. If you don't stop me, I'll just keep going forever because I love what I do. And it's clear that you love what you do as well. So I do have one question that's popped up from Jenna. We can maybe cover that and then we'll wrap up here. But Jenna asked, what's a realistic amount of time to see improvements when doing pelvic floor physical therapy? So
that's a great question. And a lot of it depends on your case, because if there are complexities with your case, I'll give you, so the kind of textbook answer is the same that you would get from an OB when asking, like, when can you start exercising after birth? Everyone says 6 to 8 weeks, because that's how long research shows it takes tissue to change.
Yeah.
But we also know from research that the first 6 weeks of any strength training program is actually just neural changes, not actual muscular changes. It's actually teaching the brain how to talk to the muscle and how to activate the muscle more efficiently. That's why you feel stronger, even though there hasn't been change to the muscle yet. So it's really hard to say sometimes, but if you feel like you're working with someone who really hears you and is giving you a program that's designed for your life, you should start to feel change almost immediately. At least I have my clients, and oftentimes the reason for feeling change is because you understand what's happening. So it's not terrifying anymore, because you feel like you're taking ownership and you're doing something about it. And then the exercises or the manual work that you might be getting done internally should also be providing relief relatively quickly. Now, is it going to be that every day is better than yesterday? No, absolutely not. There'll still be ups and downs, but it should be an upward trend, I'll say, from the first 2 or 3 weeks of treatment. And then it might be that especially the chronicity of an injury or any kind of dysfunction, pain, is one of the main predictors of how long treatment is going to take. So if you have something that's been going on for a few years, then it could take a few months to completely resolve. But you should notice an upward trend almost immediately if you're working. And you should feel good about your relationship with your provider too. That's a big thing.
Yes.
That was a little 3 left turns answer. Sorry.
No, and it makes sense. It makes sense because even if on day 1 you explain how to take deep breaths, and that's something that somebody hasn't done in the last 12 months, then you can automatically, yeah, like you said, start feeling better. And I love that you brought up the neural pathways thing, because that's something that comes up all the time with one of the most basic exercises, like a push-up. How somebody can go from doing 1 push-up to 15 push-ups in 1 month's time. Yeah, very soon, because you're not obviously not bulking up within a month, but your brain is connecting to these muscles in ways that it hasn't before. And it's like, oh, we need to do that movement. Okay, I can do that. Create neuron pathways to those muscles, and you do the movement. So that's a really cool connection, and understanding that if we haven't familiarized ourselves with the way these muscles are functioning, because again, the education system failed us, then you can automatically start to, have this really new cool relationship with a very important part of your body. Bonus points, that little note that you made about orgasm improvements.
Yes.
Like, if that's not motivation enough to manage and take care of your pelvic floor health, I don't know what is. But this was so awesome and so educational. Helene, thank you so much. I'm not going to take any more of your awesome time. I encourage everybody who's watching to attend the kickoff event, which is Thursday. At what time?
10:30 a.m.
10:30 a.m. Go to mamabearpt.com to sign up. You can follow Mamabear PT on Instagram. And with your permission, Helene, if someone's watching this on a replay, they're welcome to ask questions and you can catch up later.
Absolutely. And my email is just Helene, Helene, at mamabearpt.com. And I am open, even if you are not interested in being a client, please. I love to just talk to people about vaginas. So email me, call me, my number is everywhere. Let's chat.
Awesome. So thank you again so much for coming on to share your expertise and knowledge about our lady parts and how important it is to take care of them. Helene, stay strong. Every mama who's watching, stay strong, stay hydrated, and I will see you in the group and hopefully at this kickoff event. Take care, Helene. Bye, everyone.